Now, what causes cancers of the head and neck? Okay, so alcohol and tobacco use are big causes of that. Secondhand smoke, even smokeless tobacco, chewing tobacco, snuff, those things are very important risk factors. Very important risk factors. And so if you're carrying a can of Copenhagen around in your back pocket, you need to try to stop that. And I'll tell you right now, that's not easy, but you need to try because it's a big risk. It's a big risk. People that use tobacco and alcohol are at much greater risk of developing these cancers than people who use either one alone even. Most head and neck cancers of the mouth and the voice box are caused by tobacco and alcohol. And it wouldn't be hard to imagine that we see more of those here in the southern part of the U.S. than you do elsewhere. Now, another thing that causes head and neck cancer, squamous cell cancer, is the human papillomavirus. It's a risk factor for oral cancers that involve the tonsils and the base of the tongue. And in the U.S., the incidence of oropharyngeal cancers or mouth cancers caused by HPV infection is going up, even though there's a vaccine for HPV that's been out for quite some time and is really very commonly distributed. It's a huge percentage of kids that should be getting it that are. And I think the big problem is we still aren't quite to the point where the people who have started getting that vaccine when it was first available are at the age where they would be developing head and neck cancer. So I think we're going to find in the next probably 15 years that these rates do start to come down. But right now they're still going up. 3/4 of the oral cancers that we see are caused by chronic HPV infection.